歡迎大家嚟到今日。
Welcome to the press briefing. On stage, we have Dr. Zhang Chokwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Zhang will give us an update of the epidemic situation. Good afternoon. As said, yesterday we had 115 cases tested positive by PCR, 15 from HA Public Laboratory, and also 21 from CHP, and 79 cases tested positive by private laboratories. We had 179 positive cases by RAT, so we have 294 cases in total. And at the fifth wave, we have got 1.19 million 5,034 cases in the fifth wave, including 747,416 tested positive by PCR and 447,619 by RAT. We have done genome analysis on 82 cases. Most of them could not we cannot find L452R, and then for 14 the viral load is too low. For 68 cases we could not find L452R. Among the imported cases today, we have got 40 of them. 18 tested positive through PCR and 22 through RAT. 12 cases of them were identified at the airport. 6 arrived yesterday. That is on the 15th of May. 6 arrived 2 days ago on the 10th. We've got 23 cases identified at quarantine hotels. Samples from day 3 and day 5, and 2 taken on day 12. We've got 9 flights arriving on the 10th and the 11th of May. 5 samples taken on day 12 were tested positive by PCR at CTC. 1 was not taken on day 12, rather day 11, tested positive by RAT. For this case, it arrived in Hong Kong on the 30th of April via 5J272. The case left a hotel on the 7th of May with some interaction with another case. And there are 4 cases tested positive by PCR on day 12 at community testing centers. 1 is an 11-year-old arriving from Thailand and Singapore on the 28th of April. Before the 9th of April, the case was positive in Thailand. Although the samples were always negative while in hotel, on day 14, it was positive with a very high CT value, so we suspect it to be a positive case. Another is a 25-year-old male arriving from Australia on the 29th of April. He was positive in Australia on the 23rd of April with very high CT value, so it is a suspected positive case. Another case involved a 46-year-old female arriving from Indonesia on the 29th of April. There was no previous record. However, the CT value was 36, so it is expected to be a positive case. Another case is a 20-year-old male arriving from the U.S. on the 29th of April. Starting from the 9th of May, he had a sore throat, and then PCR was done on the 10th of May with a CT value of 23. Again, it is expected to be a local case. We investigated into his case, and also a case tested positive by RAT arriving from the Philippines on the 30th of April. Both had been to the same place for fun. Both on the 9th of April from late evening to midnight. They went to New a new wave club for billiard on the 3rd floor, Block E of Mata White Road, Kowloon, Hong Ham, Kowloon. And at least 2 confirmed cases were there during the same time. They are all local cases. One is a 23-year-old male. On the 11th of May, he tested positive. Another 40-year-old male tested positive by RAT on the 10th of May. So during the same period, we have at least 4 cases. So we suspect that some transmission has taken place there. So colleagues have been to the place, and we have approached 150 or so persons who were at the same billiard room in between 5 p.m. and midnight on the 9th of May. We found them through their vaccine pass, and we reminded them to be tested. As regards genome analysis, Public Health Laboratory has found another 4 cases of BA.2.1.2.1. All 4 cases were imported, arriving in Hong Kong from the 30th of April to the 7th of May. All of them, 3 were identified at the airport, and 1 came from Holland on the 5th of May, 1 from the U.S. through Turkey, another 1 from the U.S. Via Japan on the 7th of May, another 1 from the U.S. via South Korea on the 30th of April, and the sample taken on day 5 was positive. They were all imported. Apart from BA.2.1.2.1, we have got a total of 11 BA.2.1.2.1 cases, and we've got 2 cases of BA.4, all identified at the airport when they came to Hong Kong. 1 on the 6th of May from Ethiopia, South Africa. Another on the 7th of May from the U.S. via Japan. As for care homes, the day before last, there was 1 staff member from RCHD tested positive. Close contacts who have never been infected in the same care home have been sent to quarantine. With regard to schools, we received 14 positive cases involving 13 schools. There were 13 students and 1 teaching staff member, 1 KG, 8 primary schools, and 5 secondary schools. In 1 school, there were 3 cases involving 2 students and 1 teaching staff. The 2 students were reported today. They are siblings. The teacher, we have checked the contact between the teacher and the students, and we believe the 3 cases are not related. Death case, 1 more reported from HA. So there are a total of 9,065 cases reported from HA and 78 from non-PHA sources. So in the 5th wave, we have a total of 9,143 death cases, 3,772 male and 5,371 female, or rather 3,000 odd female and 5,000 odd male. And the analysis is very much similar to what we did in the past. As for sewage surveillance program, in the Central Western District, some positive cases were identified from Saiwan Estate. The viral load was found to be quite high, in particular from Sai Yuen Terrace, from Zhongyuan, Tongyuan, and Baiyun Terrace. There might be cases as well, because the sewage samples came from a few terraces. So the government is now carrying out restriction and testing notices operations. I understand that the government is going to collect more samples in the vicinity to gauge the situation, and RAT kits will also be distributed to the neighborhood. Checking the record of positive cases, we have got 5 cases from West Terrace involving 4 families. One family had 2 cases on the 8th of May, on the 11th, and also 3 cases today. Looking at the floors and also orientation of units affected, they are different, and we are worried because of the situation of sewage samples. There might be some other cases, so the government has stepped up testing to gauge the situation. That's all from me.
Dr. Ho, please, about the HA. Good afternoon. 829 confirmed patients are being treated at public hospitals, Northland Town Hospital Infection Control Center, and the HA's Infectious Disease Center. Yesterday, there was 1 critical case reported and 1 case that is serious. 2 critically ill patients are being treated at an ICU, and then 1 94-year-old female patient passed away yesterday. She was a resident of the RACE with 2 shots. 138 patients recovered yesterday, out of which 108 of them were discharged. In the 5th wave, 49,164 patients recovered. 48,592 have been discharged. Since the beginning of 2020, 61,544 patients recovered. 60,972 have been discharged. And then for us, we haven't recorded any patients being found to be positive as a result of admission screening or testing, and no one has been regarded as close contacts. For staff members, 22,702 were confirmed, and 22,558 had returned to work. It's now time for questions. Please identify your media organization before you speak. The one in the middle. Good afternoon. I'm from Cable TV. First of all, for Sai Wan Estate, it has been sort of locked down. Is it as bad as Kwai Chung Estate? Will they be sort of free to go tomorrow? Hong Kong U has advised medical students not to go to Kennedy Town. I want to know whether it has spread to Kennedy Town. And are you worried that this is going to set off a new wave of infection? Since RTN has been sort of issued. And then in Mata Wai, 150 people have to undergo mandatory testing. That's the case in Mata Wai. Is there an outbreak there? How many of them come from Sai Wan Estate? How serious is it? And then for the Peony Golden Court yesterday, 23 was the number given as the total number of patients involved. Any more new cases? Has the cluster been brought under control? And then for the billet hall, do you know about the situation there? What about the distance between the billet tables? And what about the ventilation system? For the cases involved, were they friends or were they strangers? They just played together? In relation to Sai Wan Estate, a restriction and testing notice has been issued. This is similar to others that have been issued. The pandemic has stabilized, And so far for the sewage surveillance outcomes, the viral load is rather low. But all of a sudden, we have a higher level here. So we are concerned as to whether there is a transmission link. But of course, there have already been a few cases at West Terrace of Saiwan Estate. We don't know whether that explains the high viral load or whether there are still other cases yet to be discovered. The university is in the vicinity, so they may be worried and they have issued a reminder. I take this opportunity to remind the residents there, if you feel uncomfortable or if you feel sick, please consult your doctor early. And for doctors in that vicinity, if you identify any patients with upper respiratory problems, urge them to undertake a test, either rapid test or you can go to a clinic to pick up a sample kit for your saliva. In relation to Sunwon Club, that is the billiard hall, we have sent staff to investigate the cases. Some of the patients may know each other, but not very close. But just that they played the games together. We have yet to find out more about the situation. For Peony Golden Court, we haven't got any new cases. The next question, the one next to her. I'm from Phoenix TV. I know that for the COVID-19 pandemic, we're having three-digit number of cases. But then when the infection calms down, there will be the compulsory universal testing. So is it the time to consider introducing mass screening? I haven't got information about this matter. I'm sorry about that. The next question. On this side, please. On the left-hand side. Good afternoon, doctors. I'm from TVB. As far as the vaccine pass is concerned, by the 30th of May, you need to have the third jab to go to scheduled premises. Are there any measures to encourage those who haven't got the third jab to receive it? I understand that some people have received SMS from government officials. In fact, that recipient has already got 2 boosters. There are also people who have got 2 jabs and has not recovered from the infection. So it is not yet time to get the third jab. So I want to know what is the criterion for you to adopt when to issue SMS to citizens to get the third dose. Otherwise, will there be confusion as a result of the lack of criteria? And then for the sewage surveillance outcome in Kennedy Town, what about the viral load? And what is your assessment of the infection risk? Are you going to do what you did in the early part of the pandemic? Just like in the case of Yau Ma Tei, that is, you lock down a small district of Yau Ma Tei for a few days. Will you do the same to Kennedy Town? Well, as to the details concerning SMS received by citizens, I know little about that. But according to my colleagues, OGO has been adopting information from vaccine passes to encourage citizens to receive their third dose. But of course, if the citizen has already been infected, then we have to find out when to get the third jab. I think it is a gentle reminder so as to sort of encourage people to get their third jab. As to the positive cases arising from the sewage surveillance scheme, the load level is very high. It may not be meaningful even if I disclose the exact level to you, but when compared with the usual cases, say for example, it may be a figure of several thousand recently or 100,000 or so. Then in the case of Saiwan, it may be millions or hundreds of millions. Good afternoon. How many imported cases are BA 2.12.1 from which countries? And then for North Korea, it is locked down. throughout the nation. It seems that there are infections. What are you going to do to counter that? Are you going to tighten up your measures to prevent imported cases? For BA 2.12.1, most of them are from the USA, some from other places like Holland. In relation to prevention of imported cases, it is not easy. In the past, we have done a lot, and still we have got imported cases and giving rise to the fifth wave. Currently, for us to guard against importation of cases, well, we have a similar variant imported to our prevailing one, so the impact on Hong Kong isn't that great. The next question, please.
SCMP. So as Hong Kong U has asked its students and staff not to dine in restaurants in the area, will the CHP issue the same warning to the public not to dine in Kennedy Town or near Saiwan Estate? And how will the CHP evaluate the risk of a larger outbreak in the Saiwan Estate and Kennedy Town or outbreaks in other districts? And does the CHP think the relaxation of social distancing rules on May 19 should be postponed based on the current situation? Thank you.
I think the individual university issued warning is based on the sewage findings. And indeed, the findings in the Saiwan estate is a bit higher than the usual finding in these few days. But we did find a few cases in that district, in that estate, in one of the buildings. We found 5 cases recently. 3 of them are reported today. So these cases might explain some of the findings in this sewage finding. Of course, there may be other cases in that district. That's why there's a restriction testing notice at the present for the Saiwan estate, and also the government is distributing rapid test kits to the nearby residents and certain workers. So we hope to ascertain and search and active case finding to a certain extent or transmission in that area. And I would like to take this opportunity to remind the public in general, if you have any upper respiratory symptoms or discomfort, do a test as soon as possible.
下題
Next, the lady over there. Good afternoon, I'm from Mingpao. Dr. Zhang, regarding the 4 cases related to a billiard room, have you found out how whether they observe the mask on rule? Did anyone remove the mask inside the room? And when was the date of onset and also the CT value? Can you do you have a rough idea who was the source patient? Could it be possible that the new arrival patient passed the disease to the other 3? And for imported cases, I'd like to know whether that case was free to go out on the 9th of May. Has he broken any rule? And as for the situation in Kennedy Town, apart from Saiwan Estate, have you seen any mini outbreaks in some of the eateries there? And then apart from Saiwan Estate, has there been any abnormal situation found in the sewage surveillance program of the vicinity? Because according to Hong Kong U, there might be potentially a cluster developing. So how are these cases related? How do you assess the risk of an outbreak in Kennedy Town? Do you think that members of the public should refrain from dining in those restaurants? And for the Peony Court, Golden Court cluster, have you completed the genome analysis? Is the variant found the prevailing one in Hong Kong? Now for Sun Mong Club all of the cases were present at the club on the 9th of May from late evening to midnight. So we have to observe the situation, but it looks likely to be a local outbreak because they were all there. We cannot identify any source because some were there on the 9th of May. Some tested positive on the 10th and some on the 11th. So we have to look for further cases among the 150 contacts before we can have a general idea. For the cases we have, of course, we will do a full genome analysis or sequencing, but information will not be available so soon. We have not seen any other cases or any outbreak in restaurants in Western District. But of course, with more testing, we may find more cases. So we have to keep in view. I have no further information. I have no further information on findings of the sewage surveillance program in other places in Western District. But of course, the relevant departments will collect more sewage samples from the vicinity. Regarding the full genome sequencing result for the restaurant in Yunnan, results are not yet available because we were only able to obtain all 23 samples for the laboratory. Speaker was off mic. We have to check again. I understand that individuals did have a drink or two while there. I'm from Orange News. My question relates to the billiard room. Now you've got some additional cases. I'd like to know where were they in the club in the main? The number of imported cases, the percentage of imported cases has risen compared with the number of local cases, and we have got a few variants as well from imported cases. How do you assess the possibility of an outbreak of the new variants in Hong Kong? Now, we have a school with 3 cases. According to Dr. Zhang, the teacher and the 2 students might not be related. Have you any idea where did they get the disease? Now, for the 3 cases involving that school, 2 were reported today. They were from the same family. So it's possible that they got the disease in the community. Another family member also tested positive. So I think the 2 cases from the same family should be related to the same household because the 2 had meal with another family member who also tested positive. For the teacher, the case was confirmed earlier, so the case might not be directly related to the 2 students. Yes, we have relatively more imported cases because we have more people coming to Hong Kong. They're tourists, and they have arrived at Hong Kong from different places on different flights. We'll closely monitor the development of new variants to see whether there is any possibility of transmission locally, so we will do more genome analysis. Any journalist who has yet to ask a question? Yes, the one at the back. I'm from HKET. Good afternoon. Hong Kong University has appealed to the students not to eat in eateries in the Western District. So you appeal to residents of the same district to follow this call? Is it better for them not to dine in these places? Now, for the 4 cases involving Sun Mong Club, do you know which had the earliest onset? So were they playing together at the same billiard table or separately? Now, for the 4 cases involving the billiard room. According to information we have now, they did not play at the same billiard room. They were just at the same space. They were aware of the presence of one another, but we have to further ascertain their locations at the club because we've just got the floor plan.
即係嗰個
In relation to the case in the Western, I think it is similar to the sewage surveillance outcomes in the past, but the viral level is a bit high, and that's why there has been an RTN. Just want to remind anybody who is not well, you should have a test as early as possible. The gentleman at the back, AM 730, good afternoon. In the case of Saiwan Estate, it is said that Saiwan Estate in the Western District is most affected. How come that Hong Kong U is appealing to its medical students not to go there? By having such an appeal, would it be causing panic to the rest of Hong Kong? For the billiard hall, you are able to identify this cluster. Is it all because somebody has to undergo a test on the 12th day, and so you identify the cluster? For the 20-year-old male coming back from the USA, did he have the onset of disease first before he went to have a billiard game, or the other way around? And then did the four of them stay at the billiard hall at the same time? Was there any overlapping of the duration of presence, or was the 20-year-old male went there, go there first? Would it be the case that all the 150 plus had to be quarantined? What about those who are recovered patients? Could they be exempted? Well, we only just identified such a cluster, so we don't have many details. All I can tell you is that we'll try to ring in the majority of them from 5 p.m. to 12 midnight. And 3 or 4 cases were involved. We have yet to understand the details before we can identify a possible source. It will be difficult to say that the person who arrived first would be the source of transmission. We respect the approach taken by any university. Quarantine. Well, anybody having meals with them, anybody having a mask-off activity, like those at the same table, those having a drink together with their mask removed, then such people have to be quarantined. It depends. We have yet to decide. We are not at this moment saying that all the 150 of them have to be quarantined. Recovered? No, the recovered. For those who have recovered within 3 months are exempted. Sorry, the speaker is off mic. We haven't seen that. Are there any other questions? Just a brief one, please. I'm from Phoenix TV News. For the past few days in Hong Kong, we have got quite a number of clusters of infection. This happened after relaxing the social distancing measures. Do you think that it is necessary to tighten up the measures again, and why? Thank you. For such clusters, it is probably because we are tracing after them, and so they were found with a lower level of cases. We're able to trace them. I think in the past, when the total number was high, there must have been many other cases that have not yet been identified by us, so it has no impact on social distancing measures. That's all for today's press conference. Thank you.